resistance, pressure, and flow. Okay, let's talk about blood flow, resistance, and how they behave in different vessel arrangements. First, look at the very top equation. This is the volumetric flow rate, which we call Q dot. It tells us how much blood is flowing through a vessel per unit time. The formula is straightforward. Q dot equals flow velocity multiplied by the cross-sectional area of the vessel. Velocity means how fast the blood is moving, and cross-sectional area means how wide the vessel is. If the vessel is wider, more blood can flow for the same speed. Now, the next concept is resistance, the opposition to blood flow. We can calculate it by dividing the driving pressure, or delta P, by the flow rate Q dot. In other words, resistance equals the pressure pushing the blood forward, divided by how much blood is actually flowing. But we can go even deeper. Using Poiseuille's law, resistance is equal to 8 times the viscosity of the blood, multiplied by the length of the vessel, divided by pi times the radius raised to the 4th power. This is important. Viscosity means how thick the blood is. Thicker blood makes it harder to flow. Longer vessels also create more resistance. And the radius is the most important factor here. Notice it's raised to the 4th power. This means even a small change in vessel radius creates a huge change in resistance. If the vessel narrows just a little, resistance shoots up dramatically. Now, let's talk about how vessels work when they're connected in different ways. First, series arrangement. Look at the diagram with R1, R2, and R3 in a straight line. In series, the total resistance is just the sum of all individual resistances. Our total equals R1 plus, R2 plus, R3, and so on. That means every segment adds to the total resistance. This is like blood flowing from arteries to arterioles to capillaries. The resistances stack up. Second, parallel arrangement. Look at the diagram where R1, R2, and R3 are side by side. Here, the total resistance is much smaller because blood can choose multiple paths. The formula is 1 over R total equals 1 over R1 plus 1 over R2 plus 1 over R3, and so on. Adding more parallel vessels reduces the total resistance. This is what we see in capillary beds, lots of branching vessels, allowing blood to flow more easily. The relationship between pressure, flow, and resistance in the cardiovascular system is directly comparable to Ohm's law in physics. In electricity, voltage equals current multiplied by resistance. In the circulatory system, delta P, or pressure, equals blood flow multiplied by resistance. From Poiseuille's law, we can see that blood flow is directly proportional to the radius of the vessel raised to the 4th power. And resistance is inversely proportional to the 4th power of the radius. This means radius is the most powerful determinant of flow. Capillaries have the highest total cross-sectional area in the circulation. Because of this large cross-section, blood moves through them at the slowest velocity, which allows more time for exchange of nutrients and gases. Blood always moves from an area of higher pressure to an area of lower pressure. The pressure gradient is the driving force for blood flow. Arterioles are the vessels that account for most of the total peripheral resistance in the circulation. This is because they have small diameters and muscular walls that can change their size to control resistance. Veins are the main storage vessel for blood. They can hold a large volume without a significant rise in pressure. The viscosity of blood depends mostly on the hematocrit, which is the proportion of red blood cells in the blood. When the hematocrit is high, as in polycythemia or in conditions with increased proteins in the blood, such as multiple myeloma, the viscosity increases. When the hematocrit is low, as in anemia, the viscosity decreases and the blood flows more easily. Cardiac and vascular function curves. Now let us look at how the pumping ability of the heart and the properties of the blood vessels interact. We can draw two curves, one that shows how the heart pumps at different filling pressures, and one that shows how blood returns to the heart from the veins. The point where these two curves meet is called the operating point of the heart. At this point, the cardiac output, which is the amount the heart pumps, and the venous return, which is the amount of blood returning to the heart, are equal. In a closed system like the circulation, what comes back to the heart must match what leaves it. Inotropy, contractility of the heart. Changes in the contractility of the heart muscle lead to changes in stroke volume, which then change cardiac output, venous return, and right atrial pressure. When the heart contracts more forcefully, it pumps more blood with each beat, which increases cardiac output. When contractility decreases, the opposite occurs. Examples of increased contractility include the effects of catecholamines, the drug dobutamine, the drug digoxin, and physical exercise. Examples of decreased contractility include heart failure with reduced ejection fraction, narcotic overdose, and sympathetic nervous system inhibition. Venous return, volume returning to the heart. Changes in circulating blood volume alter right atrial pressure, which then changes stroke volume and cardiac output. Increasing circulating volume increases venous return and cardiac output. Decreasing circulating volume reduces venous return and cardiac output. Examples of increased venous return include giving intravenous fluids, increased sympathetic nervous system activity, and the presence of an arteriovenous shunt. Examples of decreased venous return include acute hemorrhage and spinal anesthesia. Total peripheral resistance, resistance in the arteries. Changes in total peripheral resistance alter cardiac output. Changes in right atrial pressure in this case are unpredictable because they depend on other compensations in the system. Increasing total peripheral resistance usually makes it harder for the heart to pump blood forward, while decreasing resistance allows more blood to flow. Examples of increased total peripheral resistance include the use of vasopressor drugs. Examples of decreased total peripheral resistance include exercise and arteriovenous shunts. In real life, these changes do not usually happen in isolation. They often occur together and may reinforce each other. For example, during exercise, both contractility increases and total peripheral resistance decreases, which work together to maximize cardiac output. In heart failure, reduced contractility may be partly compensated by fluid retention, which increases preload and helps to maintain cardiac output.